Chronic fatigue symptoms. Chronic fatigue syndrome, or CFS, is a complicated disorder characterized by extreme fatigue that lasts for at least 6 months and that can't be fully explained by an underlying medical condition. The fatigue worsens with physical or mental activity but doesn't improve with rest. Other characteristics of the symptoms include sleep that isn't refreshing, difficulties with memory, focus, and concentration, dizziness that worsens with moving from lying down or sitting to standing. This condition is also known as myalgic encephalomyelitis, or ME. Sometimes it's abbreviated as ME or CFS. The most recent term proposed is systemic exertional intolerance disease, or SIDE. The cause of chronic fatigue syndrome is unknown, although there are many theories ranging from viral infections to psychological stress. Some experts believe chronic fatigue syndrome might be triggered by a combination of factors. There's no one single test to confirm a diagnosis of chronic fatigue syndrome. You may need a variety of medical tests to rule out other health problems that have similar symptoms. Treatment for chronic fatigue syndrome focuses on improving symptoms. Symptoms of chronic fatigue syndrome. Primary symptoms, also called core symptoms. 3 primary symptoms are required for diagnosis. Greatly lowered ability to do activities that were usual before the illness. This drop in activity level occurs along with fatigue and must last 6 months or longer. People with ME or CFS have fatigue that is very different from just being tired. The fatigue of ME or CFS can be severe. It is not a result of unusually difficult activity. It is not relieved by sleep or rest. It was not a problem before becoming ill, and it's not lifelong. Worsening of ME or CFS symptoms after physical or mental activity that would not have caused a problem before illness. This is known as post-exertional malaise, or PEM. People with ME or CFS often describe this experience as a crash, a relapse, or collapse. During PEM, any ME or CFS symptoms may get worse or first appear, including difficulty thinking, problem sleeping, sore throat, headaches, feeling dizzy, or severe tiredness. It may take days, weeks, or longer to recover from a crash. Sometimes patients may be housebound or even completely bedbound during crashes. People with ME or CFS may not be able to predict what will cause a crash or how long it will last. As examples, attending a child's school event may leave someone housebound for a couple of days and not able to do needed tasks like laundry. Shopping at a grocery store may cause a physical crash that requires a nap in the car before driving home or calling for a ride home. Taking a shower may leave someone with ME or CFS bedbound and unable to do anything for days. Keeping up with work may lead to spending evenings and weekends recovering from the effort. Sleep problems. People with ME or CFS may not feel better or less tired even after a full night's sleep. Some people with ME or CFS may have problems falling asleep or staying asleep. In addition to these core symptoms, one of the following 2 symptoms is required for diagnosis. Problems with thinking and memory. Most people with ME or CFS have trouble thinking quickly, remembering things, and paying attention to details. Patients often say they have brain fog to describe this problem because they feel stuck in a fog and not able to think clearly. Worsening of symptoms while standing or sitting upright. This is called orthostatic intolerance. People with ME or CFS may be lightheaded, dizzy, weak, or faint while standing or sitting up. They may have vision changes like blurring or seeing spots. Other common symptoms. Many, but not all people with ME or CFS have other symptoms. Pain is very common in people with ME or CFS. The type of pain, where it occurs, and how bad it is varies a lot. The pain people with ME or CFS feel is not caused by an injury. The most common types of pain in ME or CFS are muscle pain and aches, joint pain without swelling or redness, headaches either new or worsening. Some people with ME or CFS may also have tender lymph nodes in the neck or armpits, a sore throat that happens often, digestive issues like irritable bowel syndrome, chills and night sweats, allergies and sensitivities to food, odor, chemicals, light, or noise, muscle weakness, shortness of breath, irregular heartbeat. Causes of chronic fatigue syndrome. The cause of chronic fatigue syndrome is still unknown. Some people may be born with a predisposition for the disorder, which is then triggered by a combination of factors. Potential triggers include viral infections. Because some people develop chronic fatigue syndrome after having a viral infection, researchers question whether some viruses might trigger the disorder. Suspicious viruses include the Epstein-Barr virus, human herpes virus 6. No conclusive link has yet been found. Immune system problems. The immune systems of people who have chronic fatigue syndrome appear to be impaired slightly, but it's unclear if this impairment is enough to actually cause the disorder. Hormonal imbalances. People who have chronic fatigue syndrome also sometimes experience abnormal blood levels of hormone produced in the hypothalamus, pituitary glands, or adrenal glands. But the significance of these abnormalities is still unknown. Physical or emotional trauma. Some people report that they experience an injury, surgery, or significant emotional stress shortly before their symptoms began. Risk factors of chronic fatigue syndrome. Factors that may increase your risk of chronic fatigue syndrome include age. Chronic fatigue syndrome can occur at any age, but it is most commonly affecting young to middle-aged adults. Sex. Women are diagnosed with chronic fatigue syndrome much more often than men, but it may be that women are simply more likely to report their symptoms to a doctor. Complications. Possible complications of chronic fatigue syndrome include lifestyle restrictions, increased work absences, social isolation, depression. Diagnosis. There's no one single test to confirm a diagnosis of chronic fatigue syndrome. Symptoms can mimic those of many other health problems, including sleep disorders. Chronic fatigue can be caused by sleep disorders. A sleep study can determine if your rest is being disturbed by disorders such as obstructive sleep apnea, restless leg syndrome, or insomnia. Medical problems. Fatigue is a common symptom in several medical conditions such as anemia, diabetes, and underactive thyroid or hypothyroidism. Lab tests can check your blood for evidence of some of the top suspects. Mental health issues. Fatigue is also a symptom of a variety of mental health problems such as depression and anxiety. A counselor can help determine if one of these problems is causing your fatigue. It's also common for people who have chronic fatigue syndrome to also have other health problems at the same time, such as sleep disorders, irritable bowel syndrome, fibromyalgia, depression, or anxiety. In fact, there are so many overlapping symptoms between chronic fatigue syndrome and fibromyalgia that some researchers consider the two disorders to be different aspects of the same disease. Diagnostic criteria. Guidelines proposed by the United States Institute of Medicine define the fatigue associated with chronic fatigue syndrome as being so severe that it interferes with the ability to engage in pre-illness activities. Of new or definite onset, it's not lifelong. Not substantially alleviated by rest. Worsened by physical, mental, or emotional exertion. To meet the Institute of Medicine's diagnostic criteria for chronic fatigue syndrome, a person would also need to experience at least one of these two symptoms. Difficulty with memory, focus, or concentration. Dizziness that worsens with moving from lying down or sitting to standing up. These symptoms must last for at least 6 months and occur at least half the time at moderate, substantial, or severe intensity. Treatment. There is no cure for chronic fatigue syndrome. Treatment focuses on symptom relief. The most disruptive or disabling symptoms should be addressed first. Medications. Some problems associated with chronic fatigue syndrome can be improved with either prescription or over-the-counter medications. Examples include depression. Many people with long-term health problems such as chronic fatigue syndrome are also depressed. Treating your depression can make it easier for you to cope with the problems associated with chronic fatigue syndrome. Low doses of some antidepressants can also help improve sleep and relieve pain. Orthostatic intolerance. Some people with chronic fatigue syndrome, particularly adolescents, feel faint or nauseated when they stand or sit upright. Medications to regulate blood pressure or heart rhythms may be helpful. Pain. If over-the-counter medications such as ibuprofen like Advil, Motrin IB, and others, and naproxen sodium like Aleve don't help enough, prescription drugs sometimes used to treat fibromyalgia might be options for you. These include pregabalin like Lyrica, duloxetine like Cymbalta, amitriptyline or gabapentin like Neurontin. Therapy. Many people with chronic fatigue syndrome benefit from counseling. Talking with a counselor can help build coping skills to deal with chronic illness, address limitations at work or school, and improve family dynamics. It can also be helpful for managing depression. Addressing sleep problems. Sleep deprivation can make other symptoms more difficult to deal with. Your doctor might suggest avoiding caffeine or changing your bedtime routine. Sleep apnea can be treated by using a machine that delivers air pressure through a mask while you sleep. Exercise. Aggressive exercise regimens often lead to worsened symptoms, but maintaining activities that are tolerated is important to prevent deconditioning. Exercise regimens that start at a very low intensity and increase very gradually over time may be helpful in improving long-term function. Post-exertional malaise. People with chronic fatigue syndrome have a worsening of their symptoms after physical, mental, or emotional effort. This is called post-exertional malaise, and it can last for days or weeks after the exertion. People who experience post-exertional malaise often struggle to find a good balance between activity and rest. The goal is to remain active without overdoing it. You may want to keep a daily diary of your activities and symptoms so you can track how much activity is too much for you. This may help you avoid pushing too hard on the days you feel good, which can result in a crash when you feel much worse later. Alternative medicine. Many alternative therapies have been promoted for chronic fatigue syndrome, but there's not much evidence that they work. Patients with chronic fatigue syndrome may be sensitive to medications, including herbal products and supplements. Treatments that are expensive or potentially harmful should be avoided. Coping and support. The experience of chronic fatigue syndrome varies from person to person. Emotional support and counseling may help you and your loved ones deal with the uncertainties and restrictions of the disorder. You may find it therapeutic to join a support group and meet other people with chronic fatigue syndrome. Support groups aren't for everyone, and you may find that a support group adds to your stress rather than relieves it. Experiment and use your own judgment to determine what's best for you. What to expect from your doctor. Your doctor is likely to ask you a number of questions such as, what are your symptoms and when did they begin? Does anything make your symptoms better or worse? Do you have problems with memory or concentration? Are you having trouble sleeping? How often do you feel depressed or anxious? How much do your symptoms limit your ability to function? For example, have you ever had to miss school or work because of your symptoms? What treatments have you tried so far for this condition? How have they worked? What can be expected in the long term? Despite increased research efforts, CFS remains a complex condition with no exact known cause and cure. The recovery rate is only 5%. Managing CFS can therefore be challenging. You'll likely need to make lifestyle changes to adapt to your chronic fatigue. As a result, you may experience depression, anxiety, or social isolation. You might find that joining a support group can be helpful as you're making decisions and transitions. CFS progresses differently in everyone, so it's important to work with your doctor to create a treatment plan that meets your needs. Many people benefit from working with a team of healthcare providers. This can include doctors, therapists, and rehabilitation specialists. In the end, make sure to share your experience with us and don't forget to subscribe, share, and like.